In this video, I'm going to demonstrate proper draping technique. Our patient's been scrubbed and the outer wraps of our packs have been opened. So now I'm going to finish opening these wraps and we'll start draping. I want to make sure that the fabric from this wrap does not contaminate our surgical site that we prepped. And I have the scalpel blade that was opened for me. Any extra drape that you don't want that might get in the way, you can just throw on the floor. So in this pack, we have surgical instruments including towel clamps. So for draping, we're going to need these towel clamps. And they come in small and large. Typically, I'll use the small towel clamps for the first drape, the four corners. And the first layer of your draping is either paper or fabric, it doesn't matter, and it's folded in multiple ways. You want to open this up so we have a short panel here, a fold, and then an unfolded longer panel. What I'm going to do is I'm going to place my fingers in this crease on each side, and this short panel is facing the patient. So my index finger and my middle finger are in the fold, and then my ring finger and my pinky are on the surface facing me. What I'm going to do now is I'm going to bring my palms forward like this, as if I'm falling down and I'm going to catch myself. And this is how I'm going to place this drape. And the reason I do it this way is because my fingertips are very protected against inadvertently touching a non-sterile surface. And when that drape is right about where you want it to be, you can slide your fingers out and let it drop. You'll notice that I'm placing this drape right up near the xiphoid. And again, I'm draping that far wide in case I need to extend my incision. I'm unfolding this drape so that I just have one fold now, a short panel, a long panel. I put my two fingers in on each hand. My other two fingers are on the back side. I face the patient and I bring my palms up like this. I'm going to lay this to make the lateral border. And as I lay it here, what I don't want to do is I don't want to do this, because now I'll contaminate my hand. So as I lay it down, as I'm right about here, I'm simply going to lift my fingers out like that. That way I don't contaminate my fingers. I hold this corner right where those two drapes meet. I'm going to put a small towel clamp in, and this towel clamp is going to pierce both drapes and skin, and that'll hold it secure. I grab the third drape, unfold it, find the short panel, find the long panel, place my fingers in, bring my palms out, lay it down, and clamp this next corner. Now for the last drape, what you want to do is you want to do the same thing, but you want to walk over to the other side of the table. I'm not going to do that because then you won't be able to see anything. So I'm just going to place this like that. Now these drapes have some memory and they don't always stay where you want them to stay. Do your best. And if there's a point where you feel that your drapes become contaminated, you don't like where it is, ask for some assistance. You'll also notice that we have a bit of a gap between the drape and our skin. So what we can do is we can place a towel clamp right in the mid portion and through a little bit of skin to bring that down. And we can do that on both sides. As I do this, I make sure that I'm not up like this because I'm contaminated in the front of my gown. So what I have to do is keep some space between the table and my gown and just extend my arms. Okay, so we had the first layer on. Now it's time to put the second layer on. And the second layer is paper. And there's a long way and a short way. Often these drapes say where the long way is and where the short way is. So in this particular case, it says 77 this direction, and it's 53 that direction. So I'm going to have the long dimension go across like this, and the shorter dimension across like that. Now, it's best to do this with an assistant so that you can each take an end of your drape. And maybe I'll have Sally come in here and she can pretend that she is all scrubbed in. And she's going to take these two corners of the drape. And what we're going to do is we're going to take a step back. And this whole time, we're trying to keep this part of the drape nice and steady so it's not sliding all over. And then we're going to spread our arms, making sure that we don't hit anything that might contaminate us. And we're going to drop this part that's towards the head, and we're going to place this edge of the drape on the table. Now what we can do is put our tray over this drape. Can even this out a little bit. And now what we can do is we can place these larger towel clamps around the smaller towel clamps, just through this top layer, not through the bottom layer and not through the skin. This simply secures this top drape to the bottom drape. At this point, I can lean in a little bit more because this is our outer layer and it's nice and long and it's sterile, so I can step up a little bit. I like to put the towel clamps on first and then cut out a square for our surgical field. That prevents things from sliding around as we cut it out. So I'm going to take my Mayo scissors. These are my Mayo scissors. They have a blunt end and a sharp end. These are my Metzenbaums. These are for cutting tissue, so I don't want to use those. Now I'm going to cut through this top drape. And you can either cut it to the approximate dimension of your lower drape, or you can cut it a little bit shorter and then cut it more if you need to extend your incision. It's really a matter of preference. I'm going to cut this all away. Discard. And now we're all draped in. And we're ready to get our table set up and surgery to begin.